can start.
Yes, so we're all set, everybody, and really sorry for the technical glitches. We are also trying to go live on Zoom. For some odd reason, the live for Zoom is not happening, and that is exactly what we were trying to set so that everybody can join in. But nevertheless, we are recording the session, so we're going to post this on Zoom so that everybody who hasn't been able to be live with us can see that later. Thank you so much, Tasneem, for being with us today. And the session is yours. The floor is yours. Please take over.
Yeah, sure. So, hello, everybody. I see that most of you are practicing psychologists, some of you are interns, some of you are studying, and some of you have been professors in psychology as well. So, I would request most of you to keep all of you to keep your audios on mute as of now because of the technical glitches that we might have. Yes, you can keep your videos on so that I see the participants I'm talking to as well. Yeah, so I'm Tasneem, a clinical psychologist from Apollo Spectra and Apollo Cradle, Bangalore. So I started my practice immediately after my MSc. So I have 9 years plus experience. So during that tenure, I did my MPhil. Now I'm doing my PhD as well from Christ University. And mindfulness, yes, I've been trained under Dr. Shambat, who has been the proponent of the integrative self-therapy in which he practices mindfulness. So I've been trained under him, and that's how we started practicing mindfulness. Yes, of course, he was practicing it way before that. Someone says I can't hear, ma'am. Am I audible now to all of you?
Hello, we can't hear you.
You can't hear me, is it?
But I can hear you. Your voice is coming clear.
Very clear.
Okay. So I guess you need to.
I request the participants to please message in the chat box so that any message to the speaker will be delivered by the moderator.
Yeah. So what happens is you'll have to click on use computer mic or something like that initially. Then you will be able to hear me clearly, I guess. So just check it at your end. If I'm audible to others, I will continue. Since some of you said that I am audible, so let me just continue. So this is about it. So today we will be talking about mindfulness. So what I'm planning to do is I will just introduce the concept to you a little bit. So it's not something like you can just learn in one day and start using it in your therapy. So what I have planned is I will just introduce you to the concept. I will talk to you a little bit about the origin, how how there is an integration of the Eastern and Western philosophy and mindfulness. And then we will talk about the mindfulness-based therapeutic approaches that were practiced in the West, which became very popular, and people started using it in their practice as well. And what in India, yes, of course, the right way of practicing mindfulness is very little. So very few people have been practicing mindfulness in therapy in India the right way, I would say, because so that's the reason we will talk a little about the origin concepts and then move on to the therapeutic techniques. And then I will do a practical demonstration on mindfulness. I will do it on all of you. So that time I would request all of you to stay reclined and be in a quiet place where it is very peaceful, so that you follow the instructions properly, and you will learn how to do it in your therapeutic practice with more practice of mindfulness by learning more about it later. So let me just begin by I'm sharing my screen. So let me know once you all can see the PPT.
We share a white screen right now.
Can you see it now?
No.
You're not able to see? For me, it shows.
Okay. Is everybody else able to see the screen?
If anybody has been able to see the PPT, just unmute yourself and let me know, or maybe put it up in the chat box.
No, and most people are saying
Yes, ma'am. See it.
only
You
white.
see it?
Only
You
white.
can see the white screen, or can you see the PPT as well?
No, ma'am.
Ma'am, only a white
only
screen.
white
Screen.
Okay. Now?
Now we see you.
Now you see me. Okay. Uh, so how do I get it here then? Because I can see the PPT here, but it shows that I'm sharing. Okay, it's here. Maybe are you all able to see it
Yes,
now?
yes. Now it's visible.
Okay, wonderful. Okay, thank you. So let me just begin. So as I said, we would be discussing about mindfulness-based therapy. It's a short introduction that I would be talking about. You would need to know a lot more to understand what mindfulness is and start practicing it in your daily lives, as well as help your clients deal with their issues by practicing mindfulness. Because mindfulness is not something that we need to practice only to clients who need help with mental health illnesses and stuff like that, but it would help anybody and everybody get better off in their life. So that is one thing about mindfulness. Yeah, this is a short introduction about me, as I've already spoken to you all about this. So let me just proceed. Yeah. So to introduce, mindfulness is actually a practice that involves intentionally directing your attention on purpose rather than allowing it to wander. So there is something called mind wandering as well, right? There is a lot of research that has been done on mind wandering. Mindfulness is just the opposite of that. So you see how your mind is wandering, but then you get your attention back to the present moment. Um, and you start focusing your attention in the present moment without judging it, and you do it purposely initially. So it draws its origin from the Buddhist philosophy. In the Buddhist term, it was called vipassana. It also comes from the Sanskrit word smriti, which literally means that which is remembered. So there are a couple of studies which show this. Otherwise, since it was originated there, uh, mindfulness as a therapy actually started in practice by. Can you all just mute your mic, please? Anybody who is not on mute. Yeah, thank you. So a medical professor, Dr. John Kabat-Zinn, is known to have played a very vital role in this, because he was the one who got the roots of mindfulness from the Buddhist tradition, and he got it into practice in the Western philosophy, in practice scientifically. So although he has studied with the Buddhist philosopher Thich Nhat Hanh. So I hope I'm pronouncing his name properly. So he was the one who wrote multiple books on mindfulness. He wrote more than 100 books on mindfulness, and but this is more of the religious origin that he used to talk about. It was about the Buddhist philosophy that he used to talk about. He studied with him, but he imbibed many of those mindfulness techniques from the Buddhist tradition and got it into scientific practice later. So that is one thing about it. And Kabat-Zinn's in-depth study into psychological and physiological benefits of mindfulness in paying attention to the present moment, how people have been benefiting more and more by practicing paying into the present moment, inspired him to develop a approach on mindfulness. That is the mindfulness-based therapeutic approach called mindfulness-based stress reduction program. So he became the founder of this MBSR. It is popularly known as MBSR, mindfulness-based stress reduction, back in the 1970s itself, late 1970s. In his university, he started this, and he got it to find out the health benefits of mindfulness. And post that, he started one more mindfulness-based therapeutic approach. We will be talking more about MBSR and MBCT in the next slides as well. This is just a short intro I want to give you. So the mindfulness-based stress reduction program was an 8-week program, which was said to have been attended by 22,000 people at that time. And then it's been in practice later after that as well. and the MBCT is the mindfulness based cognitive therapy. So this also is an 8-week course in which clients would in which they would meet the people twice in a week, and the session would be for an hour. And that's how mindfulness based stress reduction program and mindfulness based cognitive therapy both became very popular back then in the West. So now let us come to the basic definition of mindfulness and look at the operational definition of mindfulness as well. So mindfulness refers to paying attention in a particular way on purpose in the present moment, non-judgmentally. This is the classic definition given by Kabat-Zinn, because he was the proponent of mindfulness into the scientific to get a scientific approach towards it, right? So he gave this definition. So what happens is, when we are mindful, we just allow the smooth flow of each thing. So we are not neither clinging on to the moment, nor we are pushing it away. We are not judging the moment. We are just watching our emotions, our thoughts, whatever comes in. We are just watching it non-judgmentally. So we don't evaluate it as being good or bad. Nevertheless, we label our thoughts. Like we may have thoughts about someone coming in, thoughts about your past, thoughts about what to do thoughts and stuff like that, anxiety thoughts, depressive thoughts, or happy thoughts. It could just be anything. So it just labels those thoughts as happy thoughts, and this is a thought about someone else and stuff like that. But it doesn't judge it as, okay, these are the only good thoughts or bad thoughts, so I'm judging them. You may have distracting thoughts in between. Nevertheless, you bring your attention back to observing yourself, paying attention to yourself, and at the same time you are aware of your surroundings as well. So you are aware of your here and now. So you pay attention inward, and then you are aware of your surroundings at the same time. So what is mindfulness as a process? It's actually a process of practicing the process of practicing mindfulness requires one to deliberately stabilize one's attention on specific physiological sensations. So you become aware of your physiological sensations of touch, your auditory sensations, your tactile sensations, your visual sensations. You become aware of everything, but you become more aware especially of the most prominent sensation you're feeling at that time. Like, for example, at this moment, which is the most prominent sensation you're feeling? Some of you might just be looking at the screen, so then your visual sensations are very active, or are the most prominent ones. Some of you might just be listening to it, so your auditory sensations are more prominent at this point. So that's how you pay attention to the most prominent sensation at the moment. And it is also an attempt to stay in the present moment when the mind begins to wander. So you know that your mind is wandering. So even though so many people say that, okay, we are practicing mindfulness, but then my mind starts wandering. The basic crux of mindfulness is to pay attention to the present moment. But still, what happens is I just lose that concentration and my mind starts wandering. So the basic thing is to still attempt to stay in the present moment, because that's a normal concept. So whenever the client says that my mind has started wandering, I'm not able to practice, you tell them that you are at the right track, because everybody's mind wanders. So even the one who practices mindfulness, even the one who administers mindfulness on the other person also, even his or her mind can be wandering. But the beauty of it is you attempt to bring your mind back to the present moment. So that's what you need to do, and help your clients do that as well. So, and you do that with an attitude of non-judgmental awareness by accepting the moment, accepting the thoughts. It's not like you're pushing them away. You're not telling them, okay, these are very bad thoughts, I don't want to listen to them, I don't want to think about this. You're not pushing it away. You're just staying with it. You're just accepting it. Because the most important thing in life is to accept yourself the way you are, rather than being something else or someone else, right? So that's one thing mindfulness teaches you. So the practice of focused attention on breathing and observing one's thoughts and sensations without judging or evaluating them is one of the most common practices of mindfulness. So that has been in practice since then, since the proposal of the scientific approach to mindfulness. It has been in practice since then in the West, and in India also. It is becoming very, very popular these days. You see many people say, do this mindfully, do that mindfully. Some people don't even know what exactly it means. It's a very heavy term. It has a lot of connotations with it, but people don't really know that and just use it. And there are a lot of people who know that and are using it and making it really popular in um, the East as well. So when mindfulness in practice, there are other techniques of mindfulness also. So another way of practicing mindfulness is through focused attention. So this is similar to the basic meditation practice. So you might see a lot of your clients who might say that mindfulness is mindfulness similar to meditation? Yes, it is similar to meditation, but it is not just meditation, because meditation is more of a spiritual perspective. Some of them have a religious perspective to it as well, but mindfulness is not just spiritual or religious. Dr. John Kabat-Zinn is the one who wanted to get it out of that religious or spiritual perspective and bring it into scientific practice, so that anybody and everybody can start using it. So these activities actually involve the perspective of the scientific approach actually involves a lot of physical activities, such as you have breathing exercises, guided imagery, and all these things that can be performed not just by sitting in one place. So it's not like you have to sit in one place, close your eyes and practice. Yes, initially you'll have to do that till you get the hang of it, but you can actually practice it later as well, either while standing, walking, while lying down, while eating. So what you do is, while you're eating, you actually become aware of everything that is going on, become aware of how become aware of the color of the food, the odor, the everything about it, the taste, and the way it is getting inside your mouth, and then it goes into the throat, and how each morsel is, getting inside and getting digested, and all those things you see very mindfully. So that is one way. When we talk about mindful eating, that is what we do. So this is one small practice of mindfulness. You can just practice it anywhere and everywhere. So that's how it is. And these activities can be performed either while you're alone, or you can practice it in a group. So like now I would be doing it to the entire group. So I will show you how a practical demonstration of mindfulness is. So we will be talking about how you can think with your wise mind, and how we can do a short mindfulness practice along with practicing loving kindness. So these two therapeutic techniques, I'll just demonstrate that as well. So that is what is group therapy. Of course, now we are doing it virtually owing to the pandemic. Otherwise also it's really good, because these virtual sessions get you connected to people all around the world. So that's a wonderful thing. So that's how group therapy works. So it can be done for a short while, it can be done for a longer period. It all depends on you. So as I said, I will be talking a little more about mindfulness based stress reduction. So mindfulness based stress reduction is a program that includes 2.5 hours activities, typically involving 25 to 35 participants. So when I say this, this is how it was originally developed. Later in the Indian context, it has been changed to suit the Indian context, to the Indian culture and all that. So in a group, and it is conducted every week for a period of 8 weeks. So generally when we do this approach, when we do this program, it is spread over a period of 8 weeks. It involves home assignments as well. So it's not just that you're doing mindfulness while you are there, you're doing it later as well, because there would be a lot of assignments, a lot of activities that would be given. And then there would be one full day session on mindfulness in this entire program. Although the other program, although on the other days you will have to just spend 2 hours a week, there would be one full day program as well. So the primary goal actually is to assist people in helping themselves to achieve greater levels of health and well-being, because this was it was found that the MBSR was very effective on depression. So he claimed that he could treat depression with this. And later on, there have been many psychologists, many psychiatrists who have put this into practice and found a lot of benefit in treating their clients. Now coming to the MBCT, mindfulness based cognitive therapy. You all must be knowing about cognitive therapy, right? How you deal with it, cognitive therapy, cognitive behavioral therapy, all these things everybody must have been practicing in their daily lives. So what is the mindful approach to this cognitive therapy? It is very similar. It includes elements from cognitive therapy, because here again you deal with your thoughts and your emotions through a mindfulness perspective. This also is an 8 weeks program where the clients met twice a week, and there were a lot of informal meditation practices that happened, including guided imagery. I will be doing one guided imagery. There are guided body scans while you're sitting, walking. Yoga also is something that is a part of mindful therapy. So you have these breathing exercises, focused awareness on your routine daily activities and stuff like that. So that's how you get into this body scan, guided imagery and all that. Once I do that, you'll get to know exactly how it works as well. So before I start the practical demonstration of mindfulness, I want you to know what wise mind is, because this practical demonstration that I'm doing now is about the wise mind. So we all have wise mind within us. It's not like most people say, right, that okay, you are wise enough, that's the reason you're acting like this, or maybe I'm not wise enough, I'm very immature, or people must have told you, okay, you're not wise enough and stuff like that. But wisdom is not something that only few people have and others don't. All of us have that wisdom within us. We just need to know how to imbibe it, how to practice it in our daily lives. So wise mind is actually the combination of the two states of mind, which is emotional mind and logical or rational mind. So when we are in our emotional mind, for example, someone comes and scolds you, or you have a neighbor who gets very irritable, or you have a very old friend who breaks off with you, comes and just snaps at you, speaks in a very disgraceful manner, then if you're in your emotional mind, you just cut off your friendship with that person. You say, to hell with this person's friendship, even if the friendship has been very old or whatsoever. I just want to get rid of this person. I don't want to think about anything else. This person has hurt me, and I just don't want to keep in touch with this person. And you just cut off all ties and move away. And when you're in your logical or rational mind, what you do is you think logically. You think about, okay, maybe this person has been this person has been someone who has been very upset now. Maybe he or she is going through something, or whatever. So I shouldn't think about my emotions at all. I should just think logically that whatsoever happens, this person has been my friend for so many years. So I shouldn't talk about it. I should just suppress my desire, suppress my anger also. And I should just keep going. I shouldn't talk about it. I should just think logically that I need this person's friendship or this person's relationship, and I just need to keep quiet. But when you're in your wise mind, there is an integration of your logical mind and your emotional mind. So emotionally you feel, okay, this was not right. I shouldn't allow anybody to disrespect me. There is, okay, I'm not bringing my ego into this, but there is some self dignity also that I need to maintain. So I shouldn't take it just like that. But it is not right for me to just snap at that person because of that. I need to wait for that person to calm down. And logically speaking, this person has been my friend for a long time. So I need to wait for that person to calm down, and later probably we can speak about it. It is not a right thing to just act at my impulse or speak emotionally, or it is not the right thing to even suppress my emotions by just thinking about the logic, because suppressing emotions is also not not a good thing, right? Because mindfulness also teaches you emotion regulation with cognitive reappraisal and emotional suppression, how you bring a combination of the two and regulate your emotions. That is also one of the aspects of mindfulness. So you bring both these perspectives and you think with your wise mind. So that's how this wise mind technique works. So when I'm doing this practical demonstration, just keep this in mind whenever I ask you to think about a question or think about anything, just keep this wise mind perspective in your mind, and then that's how I want you to think about. So I'm taking you through guided imagery. There would be a few questions I want you to think about, I want you to ponder over, and we'll go about it. So as I said, I request you all to keep your to be very comfortable, recline in a position that is very comfortable for you. I hope all of you are wearing your earphones, because the audio should be really clear. So take a deep, long breath. Let us begin by watching our breath, reclining. Make yourself very comfortable wherever you are, and slowly close your eyes. So as I said, initially we will need to close our eyes, sit in one place and practice this. So for now, I want you all to close your eyes, neither too tight nor too loose. Watch your breath, relax, become very comfortable. And now start imagining the things I would be telling you. Follow the suggestions like as if everything is going on right now, as if you are in that situation where all this is going on. So imagine that you are walking by the side of a clear blue lake on a beautiful day. Imagine the weather is just so beautiful. Now imagine that in this beautiful weather, while you're walking by the side of a lake, imagine you are a small flake of stone. You yourself are a very small flake of stone, which is very flat and light. And now imagine that you, the stone, have been tossed out onto the lake. And you're now slowly moving towards the lake's smooth and sandy bottom. There are ripples being caused in the lake. In these slow circles, as you move towards the bottom of the lake, I want you to notice everything that you see. Notice how you feel as you float down, perhaps in these slow circles, floating down towards the bottom of the lake. Now, as you reach the bottom of the lake, just settle your attention there within yourself. Just notice the serenity of the lake. Become aware of the calmness, the silence deep within. Become aware of everything, of all the calmness within yourself. Now, as you reach the center of yourself, just settle your attention there within yourself. Now imagine that within you there is a spiral staircase which is winding down to your very center. Now, starting at the top, walk very slowly down the staircase, going deeper and deeper within yourself. Now start noticing the sensations. You can rest there by sitting on a step or turn on the lights on the way down if you wish to. But remember, don't force yourself further than you would want to go. And now again, notice the silence. Notice the sensations within yourself. Take your time, and as you reach the center of yourself, just settle your attention there within yourself, maybe in your gut or your abdomen. Just settle your attention there. So now that I've already told you what wise mind is, as you're breathing in, just say to yourself, wise. And as you're breathing out, say to yourself and your mind, say mind. As you say it, focus your attention on the meaning of each word as you say it in your mind. So while you're breathing in, say wise, and breathing out, say mind. And continue this until you sense that you have settled into wise mind. Take a while to do this. Make sure you settle into wise mind. Now, breathing in silently, ask your wise mind a question. Just ask your wise mind any question. And while breathing out, listen to that answer carefully. Just carefully listen to it. And when I say listen, just listen. Don't give yourself the answer. Don't tell yourself this is the answer. Just listen to it. You may have distracting thoughts. Continue asking on each in-breath for a while. If you don't get an answer, don't worry. Try again. And then now breathing in, ask yourself, is this action, thought, plan, whatever I just asked, was that really wise mind? And then breathing out, listen for the answer. Again, just listen. Don't tell yourself, yes, this is wise mind. No, this isn't wise mind. Don't give yourself the answer. If you don't get an answer still, don't worry. Try again. Okay, now you all can take a deep, long breath. Relax. Just rub your palms against each other. You can rub them like this nicely. Place your palms over your eyes. Feel the warmth over your eyes. And then slowly open your eyes. Don't open it abruptly, just slowly open your eyes. Hope you guys are feeling good. Now that you've opened your eyes, just think about what are the questions you asked yourself, and the questions that you asked, were they really from your wise mind? Because we did think about wise mind. We did practice a little about what wise mind is, and were those questions really from your wise mind? So this is one technique of thinking with your wise mind, bringing the integrating both the emotional mind and the logical mind and thinking wise. So this is one practice of mindfulness, and there are other practices as well. There is another practice. Yes, all of you can open your eyes. And then if there are any questions, you can put them in the chat box as well. Or if anybody wants to unmute your mic and ask a question, you're happy to do that. And yes, there are other techniques in which we practice loving kindness, where we begin with our own selves. You begin with someone, you just slowly and comfortably, very gently sit in a very comfortable position. You can even stand, or you can, but you have to be comfortable, and you have to pay attention inward, and you have to gently bring that person to your mind to whom you want to provide loving kindness. So loving kindness is actually like a prayer you offer. So most of us offer prayers to each other, like we ask for blessings for others, or we ask for blessings for our own selves. It is better to begin with your own self, because unless you have that love within yourself, you won't be able to provide that love for others, right? It's like you cannot pour with an empty cup. You need to have that cup of coffee in that cup for you to pour coffee to others as well. So you need to have that love for yourself, and then you will be able to shower that love to others as well. So you just start with yourself, start with providing love and kindness to your own self, and then you move on to providing it to your loved ones. Then you slowly move on to people who are not who are difficult people, whom you're not very comfortable with, who have troubled you at some point in life, and you have troubling thoughts with that person. You slowly move on to that person, and then the next, and then you move on to complete humanity, to all mankind, to providing love to the entire universe, to every living creature in the universe as well. So that's how you move on to providing love and kindness to others, starting with yourself. You move on to providing that love and kindness to others. And this is another practice which we usually suggest our clients to practice at night before going to bed. Practice this every night and sleep. And so people with sleep disturbances, people with obsessive thoughts, do benefit with this. And there are mindfulness techniques where you can learn how to control your thoughts. So that's another script that I will have to do. So we will be doing that probably some other time, but for now I want you all to practice this on yourself first, so that you learn how to do it. Then as you keep doing it, every person has his or her own unique way of doing things in mindfulness. So identify what is unique for you, what works for you, and then start practicing it on your clients as well. So generate this awareness, because mindfulness is something that all of us have to practice. It's something that has a universal well-being to it. So moving on, yes, to conclude, mindfulness-based interventions, both the MBSR and MBCT, have been 8 weeks programs where 2 sessions per week are included, with a duration of an hour per session. So usually a session is 50 minutes. And the sessions are combined with group discussions, guided imagery, along with a few take-home exercises, as we just discussed. So there were psychologists and researchers who quoted that the goal of both intervention techniques has been to see that people continue these practices in their daily lives as well, because this is something you learn and then practice it in your daily life, so that your life gets better with this practice, so that you live a more healthier life, you lead your life to the fullest potential. So thank you, everyone. If you have any queries, just post in your queries. This is the time to
Yes,
ask questions.
yes. We have a couple of questions in the chat box, and I'll read them out for you one by
Sure.
one as we go along, and you answer each. So the first one is, how does mindfulness-based perspective see the death of a dear one? how could one overcome it?
Okay. Okay. So when you're facing a death of a dear one, what happens is you're obsessed with those thoughts, and you're tempted to have compulsions as well. So basically, at the extreme level, it becomes OCD, which is obsessive compulsive disorder. But at the basic level, it's just obsessions that you keep having, that this person was like this, and you have a lot of repetitive thoughts which bother you a lot. So you keep feeling that, oh, okay, these are the thoughts that this person was like this, that person was like that, and whenever you see something that you did with that person, you suddenly start weeping and you feel really bad about it. But you learn how to pay attention in the present moment rather than thinking about your past and worrying about your future. So that's the crux of mindfulness, to pay attention to the present moment. See how you can let go of those thoughts. There is a complete mindfulness thought session as well, in which we learn how to pay attention just to the present moment and keep away from those thoughts as well. So that is one thing you can do to deal with the loss of a loved one. You realize that what is the here and now is what is more important for me now, because you realize that mourning over the past, or worrying about the future, about how I can live without this person, is not going to do any good. But living the present moment, enjoying the moment as it is without worrying about anything. Although you might have distracting thoughts that this person was very important to you, how will you live without that person and stuff like that, you still think, okay, despite all that, I need to live in the present moment, because the present moment is what I have now. I neither have the past nor I have the future. So these are some of the techniques you do, the thought technique, and that's how you can get rid of that is how you can imbibe mindfulness, to get rid of the loss of a loved one, the feelings of a loss of a loved one.
But to continue with what you were saying and ask another question related to this name, but isn't everything that you said, the low and the ruminating thoughts about the past, and what if and how I'm going to adjust to a life without the person, aren't all of that part of the grieving process? And as we all know that the process of grieving and the duration of that process is different for everybody. So when you
True, very true.
when we combine that with mindfulness, to what you just said, how are we allowing the person to grieve and to to be natural in that grieving process?
Yes. So mindfulness also teaches emotion regulation, as I said. So
Okay.
here you neither suppress your emotions nor you express it so much that it is not required. You see a middle path. So mindfulness helps you see the middle path. That's what the wise mind practice is also all about. You neither go to the extremes of logical mind nor the extremes of rational mind, but you bring a combination and see the middle path. So
Okay.
while you live in the present moment, you see that you have to grieve about it also. You don't have to suppress your thoughts, because grieving about something is something that is letting you let go of the past. So while grieving for it, you do have distracting thoughts, this is like this, that is like that, but you don't judge them. You just live in the present moment. You don't push away those thoughts. You stay in the present moment. You enjoy the thoughts that are coming up. You don't see them as good or bad, because the moment I say a negative thought, you think you get that negative perspective to it. So the moment I say a positive thought, you get positive vibes to it. So you don't say these are negative or positive thoughts. These are thoughts that this person was doing this, that person was doing that. You just stay with the thoughts. You
Okay.
identify what are the emotions related to it, and then you come back in the present moment and say, okay, this is my present, this is how I live in the present moment. I need to grieve over it. I need to let go of those thoughts also, but I need to get going with my present as well. So
Okay.
that's what teaches people to continue in their daily lives, because a lot of times people get dysfunctional just grieving over the
I was
past, just
just
thinking
about to
about
say
it.
that.
Those are the extremes. Yeah.
So
So those are the extremes.
would it be
Yes, tell
okay
me.
to say would it be okay to say that what you mean when you say bringing mindfulness into the grieving process is that you maintain your balance while grieving, while having all the negative thoughts, while experiencing all the lows of the grieving process, but trying to maintain balance so that you remain functional through the process and not dwell too much.
Exactly.
Yeah.
Yeah.
All right.
Yes, yes, exactly. That's how it
Okay.
is. Because you learn to live in the present moment by evaluating that process, but not evaluating it to such an extent that, okay, this is my life is all over, it has no worth, it is I'm helpless, I'm hopeless.
Sure.
Those are the extremes. So you try to get away from the extremes and see the middle path and stay with that.
Thank you for that perspective, Tasneem. We have another question for you, which says that guided meditation is a part of mindfulness meditation, or is it another tool?
There are many tools in mindfulness itself. So guided meditation is one of the tools in mindfulness. We have guided body scan as well, we have guided meditation as well, we have other techniques where I said we practice loving kindness. So there are a lot of these techniques, but mindfulness is not just meditation. Mindfulness is also meditation, but because there are a lot of misconceptions where, especially when it came to India, it became more of yoga and meditation itself. So the scientific perspective of mindfulness was lost at that point. So that is also one of the parts, or one of the aspects of mindfulness, is one of the tools of mindfulness. But mindfulness is not just that, it is much beyond that as well.
Okay, so so put this into a perspective. Would it be okay to say that when we look at practicing mindfulness in therapy, or integrate that with therapy, we have to kind of amalgamate and shift focus from the Eastern philosophy of mindfulness, and tweak it a little bit in terms of scientific evidence and with other kind of therapeutic modalities, so that we can practice it in a more rational and in a more evidence-based and scientific issues related with the symptomology and the issues that the person may be feeling for a particular disorder or disease?
Yes, very true. So the psychologist will have to customize the practice of mindfulness depending on the uniqueness of each client. So it's not like this is a general practice, you can do the same thing for everyone. It is different for different people. So as you keep practicing it on yourself, you will learn to imbibe the different techniques of mindfulness. So that's the reason I said all of you practice it on yourself first. And the best thing to learn mindfulness is practice, practice, and practice. So you need to keep practicing it to know how to gain insights within your own self. And then you must have dealt with a lot of clients who will come into this process, who you will think about, okay, maybe this technique would have work best for this client and stuff like that. So based on what works best for which client, you will be doing that to those clients. And yes, as I said, it's not just for, so Kebitzin also wanted to say that it is not just for people with some mental illness. It is something that can be used for anybody and everybody. Although he did it in the hospital, he practiced it in the clinic, but still he said that it is very useful for others as well, because there are studies that show that it has been very useful for people without anything also. So there are some basic generalized things that like as I said, the wise mind practice, this is a very general practice which can be done for anybody and everybody. But as you said, based on the client's the symptoms of a particular disorder, you will have to find out what works best for each client. So that's how you.
I think that's a very interesting perspective, Tasneem, because a lot of the times when we start practicing a therapy, whatever therapy it is, whatever psychotherapic modality we train ourselves in, we kind of view it as the end all and be all. Whereas, you know, if we have an eclectic approach to therapy, where we may be following a therapy to the T, but we can use tools and aspects of different therapies into that therapy. For example, I extensively use CBT and REBT, but that doesn't mean that I don't incorporate tools from other therapies depending upon the need of the client, right? So I think
integrative
similarly,
approach is the best.
yes.
Yeah.
So I think similarly with mindfulness, because all therapies are somewhat evolving, and it doesn't, not everything suits everybody. So we have to have that integrative and eclectic approach. Great perspective, Tasneem. And we have a lot of other questions also for you.
Thank you so
So
much.
I'll just bring it on. So if there is a constant threat from the environment, like office, then how can mindfulness help us being non-judgmental?
Okay. So here you're talking about, there's something called mindfulness at the workplace as well. So when there is a constant threat from the workplace, this wise mind technique, which I just discussed, works very well, because when you have that threat, it could be something that you are perceiving it. So we actually cannot change the environment as such. We cannot change the other person. The only person we can change is our own self. So we need to change our perspective towards things. And once we change our perspective, we see how the perspective of everything else changes. Everybody else changes towards us, their perspective towards us changes, our perspective towards them changes, and that's how we see the changes in our workplace as well. Because when there is a constant threat, it's probably a threat that you are assuming, or it's a real threat also. So when you have something like that, and you deal with it, the way you deal with it is all that matters. So when you imbibe this wise mind technique, you try to see, okay, this is the logical perspective towards it, this is the emotional perspective towards it, and I bring my wise mind perspective towards it, and I deal with it not just in your mind. Whatever you deal in your mind actually shows in your actions as well, because as we know, our thoughts, our behaviors, our actions, everything are related, right? How we feel, we get those thoughts, we get our thoughts depending on what we feel, and our actions are also based on our feelings and our thoughts. So if there is an alteration in that itself, if the perspective itself changes, then our actions change, and based on our actions, others actions change towards us as well. So that's how you can deal with threat at your workplace as well.
Let's put another perspective on this, and put this in perspective of an abusive relationship or a toxic relationship, if not abusive. How would we then apply wise mind in that scenario? Because that is constant emotional, physical, intellectual, religious, financial threat to your existence all the time, living in a
Yes.
toxic relationship. So how
Yes.
can we apply wise mind in that kind of a toxic environment?
So you try to identify what is best for you. So you try to find out whether living in that relationship is the best thing for you. You apply the wise mind technique, where I said you think about it logically speaking, okay, this is the best relationship for me. Emotionally speaking, there have emotionally speaking, maybe this is a very toxic relationship and I'm getting demoralized and stuff like that, but logically speaking, I do need it. But at the same time, you would try to analyze, okay, do I need it so much at the cost of my emotions, at the cost of my well-being? If you're getting so affected that your well-being is getting affected, is it really worth it? So you try to analyze this, and this analysis doesn't just happen by sitting in one place like how I practice it now, but as you keep practicing it, it goes on at the back of your mind all the time. So you don't even know that you're applying the wise mind technique to it, and you're still applying it. So that's how you think wise, and then you take a decision even in a toxic relationship. So this is one thing that generally applies for everything, but there are things which we specifically use for specific things as well. There are mindfulness practices for specific things as well.
Okay. So, taking what you just said forward, this name, would it be okay to say that a popular belief says that mindfulness is about non-analysis of situations and non-logic, not putting rationale and logic to it. But from everything that you've said, what I can concur and understand is that yes, that may be one part of mindfulness, but the other part of mindfulness is also to give a rationale and logic to everything that is happening in your life, to reduce the maladjustments and to reduce the dysfunctions, whatever may be, whether that is for mental illnesses or for mental health and personal development. Would that be okay?
Yeah. So the non-judgmental perspective and the evaluation of whether you're using your wise mind are two different things actually. So when you're judging a person, you just judge a person as good or bad. So here it is not good or bad, but here you're labeling things into different perspectives. So one of the aspects of mindfulness is to label things into, okay, these are logical thoughts, these are emotional thoughts. You're not telling that logical thoughts are good or bad. You're not telling that emotional thoughts are good or bad. You're telling that both exist. I'm just trying to integrate both. I'm trying to see how I can see the middle path between the logic and emotions behind it. It's not like I'm integrating good or bad. So that's where the judgmental or non-judgmental perspective of mindfulness comes in.
Okay, that's really interesting, and I think that is what takes the mindfulness practice to another level, probably. And to dissociate from the aspect of negative or positive labeling, and while maintaining a perspective of dysfunction or function, and purposefulness or non-purposefulness. Another question we have is that, could it be said that guided meditation is the shift in consciousness from one trance to another trance for a while?
For a while, yes. but not everybody gets into the trance. So guided meditation, like if you have practiced hypnotherapy as well, you would know that you would get into a trance. So guided meditation is one aspect of it. It's not completely that, but just one aspect of it. For the moment you get into another trance, you identify your own self, you get a deeper insight within yourself, and it doesn't just live there, you continue it later as well. Because many a times we speak, even in talk therapy, we speak a lot of things about our own selves, and then we realize that you realize things that you've never realized about yourself. And you feel, okay, I was just talking, then how did then how is it going to benefit me? But then you have never spoken about it in your life all this while, and you speak about it in talk therapy. So that's the same thing with guided meditation as well, where you bring out things that you've never thought of, and then with that trance you get that, you elaborate it in your everyday practices, in your everyday life as well. Like for example, you get into a realization that, maybe I'm good at this, or maybe I'm bad at this, and then you try to reinforce that thing, and you try to motivate yourself to do more of that, and that's how it changes. That's one thing about it.
Okay, that's very interesting and rightly put, that it may not necessarily be a state of trance per se, but or may not rather, but a higher state of personal awareness, that
Awareness.
transcends into one's personal life, and how it is applied in one's personal life, right?
True, very true. Because it's more about application. All these therapeutic techniques are more about application, applying it in real life. Because as Segal had put it very well, that, the basic intent of these practices was to see that the clients not just practice it during those group therapy sessions, but imbibe those techniques later as well, to get a better living,
Good.
to improve their life.
Another thing that I wanted to ask was that I know you talk about the 8-week practice and 2-hour weekly sessions. Is there any other way or any other form in which one can learn to be mindful? Any school that one can go to, and I'm talking about the Western scientific therapeutic model of mindfulness, and not the Indian model. So any specific school,
Yes.
any specific training institute that one can look into?
I'm not aware of any mindfulness training schools in the West as well, West as such. But then, yes, there are many therapeutic techniques which each psychiatrist, each psychologist has imbibed those techniques and come up with their own therapeutic modalities, where they integrate that therapeutic technique into their therapeutic practices. Because see, when we do DBT, CBT, REBT and all, we learn something, but then what we do is brings our uniqueness into it. Yes, we follow a particular template, we need to follow the basic instructions, basic set of guidelines and all that, but we do have our uniqueness as well. So each psychologist or psychiatrist, who any mental health professional who has taken it up, has imbibed his or her own techniques. It's not like you have to do an 8-week session itself, you have to do it once in a week, okay, twice a week itself. It's not like that. Depending on your clients, you can customize it. So there also people have been doing that, but I don't know if they are providing training as such in yes, it has been very popular there, but I'm not aware of any training institute or as such for mindfulness.
For example, the MBCT is taught, of course, by the Beck
Your
Institute
voice
in
is breaking.
Philadelphia. Are you able to hear me? Tasneem, you able to hear me?
Yes, I can hear you now.
Okay. So I know that the Beck Institute in Philadelphia teaches MBCT, and they have a couple of
Beck has
weeks
done a
course.
lot of studies on that as well. There are a lot of research
Yes, there are a lot of
articles.
research that they've done of
Yes.
MBCT,
Yes.
and then of course DBT practice, and Linehan teaches DBT, and there are courses, yes, that she does, and her workbooks are freely available for everyone to buy if they want to do it. So would it be okay to say that to bring it into practice first on oneself and then to apply it on the clients would be the best approach? And
Yes,
in order for us to learn it and imbibe that in therapy, we may not necessarily have to go to a school, but we can use these workbooks, we can use these and these are extensive workbooks. I have worked on one myself, and it's quite quite
Yes. So it's
experiential
very,
and
yeah. So it's very good to, read about all these things and start imbibing those techniques as well. And, there are some webinars also that come up by
yeah.
experts. So there are some proponents of mindfulness-based therapeutic techniques. A lot of them, if you stay tuned, you will get to know about all that. If you try to inquire a bit, you will get to know more people who are doing these training sessions, because you can always take it online. You don't have to be there, right? So even from the West, you can get it here, and that's how people have started practicing it in India as well. And yes, these books have been very helpful, but I would advise all of you to read a lot of books, not just sometimes there's a possibility where we just read one book and we think we know everything and we start practicing it, but then learn a lot of books on that, try to understand the concept behind it, the origin of it, and then try to read more books on those concepts, and then come to the practical approach of it, then come to practice it. But as you said before, practice it on your own self, and then you know how, because while you practice it on yourself, you get to know, okay, this client needs that, this is the issue with that client. So self-reflection is very important for psychologists as such, right? Whenever we are dealing with clients, we keep thinking about, it's not just during the therapeutics, during the session that we think about the client, we do think about the clients later as well, and we suddenly get an idea, a bright idea, that this probably might apply on this client, this could be good for this person or that person. So yes, keep practicing it on yourself. Read a lot about it, do attend a lot of webinars and all that, and it will definitely help you all learn this. So we are actually planning to get it in the syllabus itself, so that at a very early age people do understand it, not just psychologists, but at the general level everybody needs to understand some part of it, which is very essential, because as I said, it's not just for psychologists or mental health professionals or for the ones going through mental health issues, but it is something that is common for everyone, but that would be helpful for anybody and everyone. So
Mhm.
that's
Would
about
you
it.
would you be able to suggest some books for everyone to read? A couple of
Yeah,
them.
there is a book by John Kabat-Zinn, Titch
Tish
Nat
Nhat Hat.
Han.
Yes.
Okay, so there are a lot of books by both these philosophers. You can read those books, and for the practical application of it, Marsha Linehan, there are two volumes. Different volumes you can practice it. One is for yourself, one is for the client, so you can use these books. But before that, just read up the books that have been given by Kabat-Zinn and Thich
Oh,
Nhat Hanh.
yeah, yeah. Difficult name to
Yeah.
pronounce. It's okay.
Yes, yes.
And as they say, what's in a name? So it's all right.
Very true. So you
Yeah.
got to know what it is. He's a Buddhist philosopher. So that's how the Buddhist monk got all this. And both of them, like when Kabat-Zinn was actually studying with him, but
Mhm.
he wanted to bring out the Buddhist tradition to the scientific approach.
Okay.
So he tried to analyze how it could be beneficial for people. And that's when he proposed this MBSR. That was the first thing that he proposed out of that.
Okay.
So
Okay.
that's how it
We
is.
have another question here, Tasneem. It says,
Sure.
how does mindfulness see individual? Bundle of thoughts which contains past and future stuff of something else?
Hmm. Okay, so how does mindfulness
View an individual.
view an individual as a bundle of thoughts, you mean? Okay,
Whether
there is,
it says that whether they're just a bundle of thoughts that contains past or future, or there's something more to it.
okay. So mindfulness is very different. It is about paying attention in your present moment, but there are mindfulness of thoughts. There are different scripts, practices to mindfulness, which I said. You see a bundle of thoughts, you try to disentangle them, because sometimes there are a lot of thoughts. So what we do is you try to analyze where these thoughts are coming from, and how they are just rising up and down, how they are just coming and going. So you just view them as they are coming and going. You don't have to cling on to any thought. You don't have to push away any thought because it is
Mhm.
disturbing you. You just stay with those thoughts. You disentangle them. You put them into different boxes, like these are anxiety thoughts, these are helpful thoughts, these are thoughts about your past, these are thoughts about your mother, these are thoughts about what you want to do in your future. You just disentangle them, and then you let them go, and then you deal with each thought at a time. The thought you are in at the present moment. Because when there are too many thoughts, they are entangled and you're not able to deal with anything. That's where the confusion comes, and that's where you feel bad about, you start losing happiness, because there are a lot of things you're confused, you don't know how to deal with it. And then happiness comes when you find a solution to something, right? So mindfulness is not about finding a solution, but you just see each thing at a time, you stay in the present moment, and it just comes. So you don't have to say this is the answer to this question and stuff like that. You just wait for it to come, and it doesn't come the first time itself. It takes time, so you need to keep practicing that. That's how it is.
I think this question about the individual and a bundle of thought, and also all of this also arises when we read the Eastern literature, which talks about mindfulness in terms of the body, in terms of the being and the individual in relation with the world and all of that.
Yes, the here and now. You
Yes.
get aware about your present moment, and at the same time, you're aware of the here and now. You're aware of your surroundings as well.
Yeah.
So that also is there in the scientific approach, because he has imbibed both into this, right? So if you just practice the Western philosophy, it is already an integration of the Eastern techniques. So you can just do that as well.
Okay. Maybe this takes us to a longer discussion at a later stage. We can talk about the integration of the Western and the Eastern philosophy, and what the Eastern says about the body, mind, and the individual and the being, and what the Western says it in terms of integrating into psychotherapy.
Therapeutic techniques,
Yeah,
yeah.
we have a couple of more questions. People have really asked about books and manuals. I'd just like to say that
Okay.
Tasneem has
There's
already spoken to us about books and given us a couple of names.
You'll actually get these books on Amazon itself. You can just
Yeah.
order them online. Most of these books are available. One such book is, you can search for Kabat-Zinn's books. You will get a lot of books in about him. And so all his books are on, most of his books are on mindfulness, even the other
Can you
Buddhist
spell
one that I said.
Kabat-Zinn, please, for
Yeah,
everybody?
I'll just put up that slide itself for you.
Okay, all right. Okay. Also,
Yeah, so you can see
everybody's
here, Kabat-Zinn.
Kabat-Zinn. Okay,
Yeah.
Kabat-Zinn.
So Dr. John Kabat-Zinn is his full name.
Okay. What a couple of people have also asked if you can share this PPT with us. Although the video recording
Yes.
of this is going to go up on Facebook, and we're going to send a link to this on WhatsApp also. But
Sure, I'll do that.
yeah, all right.
Yeah.
That'll be lovely. Do we
I'll
have?
share it with you so that you
Sure,
can
sure.
just share it with the rest of the
All
members.
right, all right. Do we have any more questions? Do we have more questions for Tasneem, please?
So in case you have more questions, you can just take down my email ID, which is mentioned here. You can just note it down, or you can even like my Facebook page, Tasneem Psychologist, and you can post in your queries either on the page or on Messenger, anything. Would do, because I do a lot of talks on and blogs on mindfulness and other therapeutic techniques on my Facebook page, and I keep posting them there as well. So you can stay tuned and you can get the latest information on that as well. Or you can
Sure.
just write in an email and I will answer your queries.
Sure. Somebody's also asked, this is just the last question I'll post here, that what is the difference between meditation and mindfulness technique?
Yeah, that's a very important question. A lot of people have asked me this question actually, that it looks similar to meditation. So what is the difference between the two? So it's not that there is a difference between the two. Meditation is also a part of mindfulness, but mindfulness is not just meditation. It goes beyond it as well, because it's used in therapy. So we try to find out the scientific roots of it. From the Buddhist root, we try to find out the scientific approach of mindfulness as well. So in mindfulness, what we do is we customize the mindful activities according to what the person is going through as well, right? So beyond meditation, you practice it in your real life, and you start analyzing things, and like how you do CBT. So once you start doing CBT, you start doing that without the thought record also. even
Yeah.
in your mind it keeps going on, right?
True,
So
true.
so the same thing with mindfulness, we do it with DBT as well, dialectical behavioral therapy, where there are some problem analysis, there's a list of problem analysis things that go on. There is a list of how you can think about things with your what are the core belief things that are there. So that is the MBCT perspective, this is the MBSR perspective. There are different perspectives to it. So
Okay.
here we have a set pattern where we follow, and that set pattern can be customized based on our clients. But meditation is something that we just look into our own selves, we deal with our here and now as well, we get more insightful within our own selves. So that also is a part of mindfulness. So along with that, we do other techniques as well.
So
That's the difference.
would it be okay to conclude this question with saying that meditation is part of mindfulness and it is one of the tools to
Yes,
heighten the awareness, whereas mindfulness is a continuous process and it's a
which
way
is much
of
more
living.
than that. Yes, very
Yeah?
true.
All right.
Perfect.
Okay, somebody's just put this question again, and I would really like you to answer this, Tasneem. I'm sorry I'm taking too
Sure.
much of your time, but they say that at what age we can start mindfulness? Is it good for pre-primary kids as well? And how early can the practice be started?
Yes, this is another question I've been asked very often. So, yes, mindfulness can be practiced among pre-primary kids. I mean, among primary kids, but pre-primary, I doubt they will be able to. Yes, what they can do is they can just stay in the present moment. They, for ADHD kids especially, you can teach them how to pay attention to a particular thing rather than becoming very hyperactive and having the deficit of attention. So for those kids, it works very well. But at a very young age, it doesn't work, because I tried practicing it on a 4-year-old kid as well. It doesn't really work that way. So I wouldn't recommend practicing it at a very young age. But with primary, yes, after age 9 and above, it has worked very well. So I would suggest you can practice it on um, from age beyond 9 as
Okay.
such. But
Wow.
below that, because it becomes very difficult for them to sit, to make them sit itself is a
It's a
very
task. Yes,
yeah.
it is. It is.
So
So
that's how you can.
thank you so much, Tasneem, for being with
Thank you,
us.
Snigdha.
And Tasneem's ID is here. She shared a Facebook page with everyone. You can please follow her and post questions either through email or on her page. And I'm sure she'll answer, because she's one of the most passionate people I've seen about mental health and about serving others. And she's been kind enough to be with us today. And initially, I told her it's going to be 30 minutes, but it's taken us longer. And she's been kind enough to be with us despite all the technical glitches and all the problems. You guys have been very patient with us today, so I thank you so much for being part of the session today. And be with us. Of course, you know that we meet every Sunday at 11 o'clock, and we're going to be there next week as well. So thank you so much, everybody. Thank you, Tasneem, and see you all next Sunday. Thank you for being with us. Bye bye. See you.
Thank you so much. Thank you, the entire group, for being so patient and following the techniques that I said. I hope all of you have benefited with it and have learned a lot of beneficial techniques that you would be following later and imbibing in your practice as well later. It's been a wonderful interacting with all of you. Of course, it couldn't be a real-time interaction. That would be much better. But this also has been wonderful. Thank you so much, Snigdha, for giving me the opportunity, and
Thank you.
let's stay
Thank
connected.
you.
Thank you so much.
So we might switch to another mode and not Zoom. We're still working on that. So we will inform everybody of how it's going to be. But please don't worry. We will keep this going. We might not be on Zoom, but we will be on another app. So thank you so much, and I'll see everybody next Sunday. Yeah. Thank you. Bye
Thank
bye.
you.
Bye.
Bye.